Thank you so much for coming and talking to us today.
Happy to be here.
Really appreciate it. Caregiving is such an important subject to our members and really to everyone. First of all, if I'm looking for what's available for me to help care for a loved one, what can the area agencies on aging provide?
Well, they can do a lot. They can help in a number of ways. And I'm glad that you mentioned Area Agency on Aging because we are probably the best kept secret for a lot of people who've never heard of them. And they offer all kinds of resources to people when they're calling, whether it's finding out about the local senior center, where they could get a meal, to really having special needs like a parent that they're very worried about and they need some assistance with. So there's a range of things that area agencies can do. It's just you may not find them you're not going to find it in a directory called the Area Agency on Aging too often. That's another thing that confuses people.
Yeah, I've heard the AAA, as it's called, and like a lot of people think of the auto service. This is not that.
No, we're the other AAA.
Exactly.
You don't call us to change your tire. You call us maybe if you want to get a home-delivered meal for your mom.
Yeah. If I'm a caregiver and perhaps I'm new to it, or maybe I've been doing it a long time, but carrying the load myself, what kind of services can area agencies on aging help me with?
So we're lucky in Washington State because we're progressive in a lot of ways when it comes to supporting older adults. And we've had a caregiver program in our state since really the late 80s. We've been doing support for family caregivers since a formal program, I'd say, since 1990. And it's called the Family Caregiver Support Program. And every area agency on aging in the state of Washington, there are 13, offer that service. Because it's a statewide program. In King County, because King County is so large, those supports for families are done through contracted agencies because, they have a very diverse community, and so they have different partners in the community who can help serve different ethnic groups, different languages, people who speak different languages. And many of the area agencies in our state, they operate the Family Caregiver Support Program right out of their internal offices. And so when people call and mention anything that either says caregiver or it sounds like they're worried about somebody that they may be helping out, that's sort of a clue for the person answering the phone to then follow up with questions that help them determine what kind of information that person may be looking for, what kind of resources that might be available to them. And that's just the beginning of what can be a pretty extensive process in helping a person identify their needs.
So what are some of the common needs that AAAs can help?
The answer to that is what started the whole program, which was the concept of respite, that, I just need a break. I love mom, I want to take care of her, but I need a break. And so when we started looking at those kind of supports, that was the very first program. And then out of that grew training, counseling, other support services, educational programs. It's added like a suite of services that to better address people's needs. But respite's always been the core of the program. And that's a real challenge right now because we have a workforce challenge. So it's hard to find paid caregivers to be able to provide respite. But I would say that's one of the biggest needs we hear from people.
And if I'm hearing this, I'm thinking I'd like some respite from caregiving. How can the agency help me?
In King County, there's a website or a phone number you can call, and it's called Community Living Connections. So that's why I say it gets confusing if you get too hung up on the terminology. So it doesn't say Area Agency on Aging, but it's Community Living Connections. And they even have advertised on the website, if you're a caregiver, call this number, and so they actually put you through a screening process. They ask you just some very basic questions, and then that helps them determine if somebody's just at an early stage trying to get information or if they're really ready for more services. And then there's it's an entire evidence-based approach to providing like an assessment for the individual. And this is what's great about the Family Caregiver Support Program is it focuses on the caregiver. Most of the time, we're always worried about how is mom doing? Go to the doctor, make sure she has her meds. Is she getting to her therapies? Is she eating right? Are we doing? nobody's asking about me and how I'm doing. And that's the beauty of the Family Caregiver Support Program. It's all about how the caregiver's doing and how to support them to stay in that role longer. It's a tailored assessment to find out what the caregiver needs. And they actually, through the process of walking a person through these questions and sort of the interview, they actually can come out with a menu of services that they think will help that individual and help kind of tailor to their needs.
Yeah, I'm kind of reminded of my own caregiving journey where home hospice care, that was a program that we found out about, would never have known about. And it really just made a tremendous difference for our family and for my mom. Is that the kind of thing that the assessment will help with?
The person who's doing the assessment, it helps them find out what the needs are. And one of the roles that area agencies have always played is to know the resources in the community and to be able to refer. And so for hospice, which you qualify for typically under Medicare, that would be a service that we might say, oh, we see you're at a stage where you could benefit from this and that. And the area agency can help people in terms of, figuring out how to access that. But it's not a specific service that the Family Caregiver Support Program. We don't want to duplicate things that are already out there to serve people. And hospice is a very, very successful, important service that's helped people a lot.
So let's back up a little bit and let me ask you, what is an area agency on aging? I understand there's one in each county in Washington, is that correct?
All 39 counties in the state of Washington are served by an area agency on aging. Some of them are single county, Snohomish, King, Pierce, Kitsap. Some are multiple county areas, because it has a lot to do, too, with your population base. Mm-hmm. But we have in Eastern Washington an area agency that serves 8 or more counties, and we have in Southeast. So those area agencies that have multiple counties are set up in a structure as a council of government. So they're specifically formed. Their sole function is to be an area agency on aging, and they're designated, and this comes through a federal and state designation. And then we have 2 tribal AAAs that are connected with the Yakima Nation and the Colville Confederated Tribe.
Okay. So I guess the question that I have for you is I run into a lot of people who are just confronting caregiving for their parents. Their parents have been older for a long time. They themselves have been adults for a long time, but it's kind of, gone along. And then suddenly something happens, one of the parents starts to feel like, perhaps things are changing or they take a fall or something along that line. And suddenly caregiving is now on the front burner. What sort of advice would you have for someone who finds themselves in that spot?
What I'd love to do is help people earlier in the journey, because I think many of us are caregivers long before we ever think of ourselves as caregivers. I mean, we're all in some way. I mean, if you've raised children, but I think it's not, I take mom to the store once a week. Oh, I go and get her prescriptions for her. I make sure she's doing banking, that things work. So we like to try to help people see, you may not realize it, but you are in a caregiving role. And the earlier we can help people identify how they're supporting somebody and what that does for them, they can be a little more proactive, because it's human nature. We don't hear from people until there's a crisis or emergency. It's the holidays. You come back to visit your parents and, oh my gosh, what's happened to mom? I can't believe how much she's changed in the last 6 months. Something's wrong. And then it's suddenly a crisis or a fall. Any kind of injury can really set a lot of things in motion that are, challenging for the individual and their health. But I always like to try to get people to think about, if you're finding yourself having questions or wanting assistance, seek that out and begin early. And especially because, as with so many people getting older and living longer, we have an increase in dementia. And that's the one that I think people often find the most challenging. And we all know now that the earlier we can detect the signs, there's a lot more that can be done in terms of mediating or moderating the effects. So I just want to say to people, if you have questions, reach out, look for support. There's a lot of information out there these days to help people.
Do you have any examples that come to mind of somebody who has been really helped by AAA in a way that you might not have expected?
Oh gosh, probably lots of times. I think it's really interesting. It can be very small ways of just, I didn't understand my mom's diagnosis or my sister's diagnosis, or I didn't know how to help her. Her behaviors are really strange, and I don't know how to handle this and how to support her. And so I always think of cases where we have folks who maybe will go through a training program. There's some really great models of exercise programs that you can do as a pair. They call it a dyad, and it supports both the person, say, with dementia as well as the caregiver. And I just think that people have a lot of appreciation when they know other folks understand what they're going through, and sometimes just give them tips. Here's a better way to handle this, or you probably would be available for this program. You should really be signing up to make sure you're getting these benefits. Because we hear a lot about, you've heard of SNAP, the SNAP program. It's like, food vouchers for lower income. There's a lot of people who qualify for that who don't know. And so one of the ways we can do is really help a person figure out what their situation is and where we can help them find resources.
Are there a lot of free or low-cost resources for people that they don't know about?
There's so many things that are available on Zoom. And COVID, for one thing, COVID did do is we just got used to living sort of much more in a virtual world. And there's loads of free exercise classes, and I think you can get videos from training programs or like techniques for working with individuals. So I think there's so much, it's hard to know where to begin and what to find. But even in the libraries nowadays, they have specialists who specialize in resources for older adults. And it's worth even checking at your local library about, hey, what kind of resources is there? Somebody there who can help me?
I think a lot of people think that they can handle caregiving on their own, that it's kind of a point of pride, or
Right.
They want to show the love to their parents. What would you say to someone like that?
Yeah.
Should you do caregiving on your own?
That's a tough one. That's a tough one because you're right, in particular cultures. One of the things I've talked about, the T-care, the assessment, one of the things we've learned is a problem is that's a little bit kind of mainstream type of assessment. And so for many of our other communities that are ethnic communities, it doesn't work because you're right. There's shame in saying I can't take care or I'm frustrated. The term we talk about burden in terms of caregiving, that's a word you would never want to use in certain communities. It would be awful to admit that somebody's a burden. They're your loved ones. We really want to make sure we're addressing what is culturally appropriate, culturally sensitive.
Do you think that caregivers often feel alone?
I think it's not uncommon. It's often women who are, in that role, and it's sort of an extension of the role they play in the family anyway. And I can think of like my own family, for example. There tends to be one person who everybody kind of leans on. They'll take care of things. It is important to remind people that there's no shame in asking for help. In fact, it's a good thing because it allows you to be able to do what you want to do longer. You want to be there for your loved one. You want to be able to take care of them. But nobody can do that all on their own, or should try, or should feel like they have to. And I hope we've started to get that message more to people. But yeah, there's still the work involved, and unless you find a sort of a community that you can be a part of. I know there are, even on Facebook, there's caregiver support groups for one another, and I do know that some people are better at seeking that out and getting the support they need than others. But that's an important point, you're right, so that people don't feel they're alone.
It seems like we hear more about cognitive decline and Alzheimer's and dementia and conditions of that nature. Does it seem to you at all that that's increasing? And is there a role for the AAAs in helping people deal with that?
Absolutely. That's a good question. I think I feel like I hear more about it and know of more people. I do know that statistically, we've been hearing for some time that once you reach the age of 85, 1 out of 3 of us is going to have some kind of cognitive difficulty. So just the fact that so many of us are living to older ages, I think we're seeing increases in the number of folks with dementia. I also think that in the medical profession, for the longest time, doctors didn't want to diagnose that because there wasn't anything they could do. Mm-hmm. It's sort of like, why am I going to tell this person this awful news? And so I think that we've taken away a lot of the stigma so that now the medical profession is doing a better job. We're encouraging people, as if you're starting to notice something, get in. The earlier you can identify if you are having any kind of cognitive deficits, that there's medication, there are things that can help. So I do feel like we are seeing more of it, but we are also more aware of it. And when it comes to the area agencies, again, they are specializing more and more in areas of dementia because of the needs of the population and the people they serve. And we're even piloting a new program that the state legislature funded for Dementia Resource Catalyst. And that came out of a statewide group called the Dementia Action Collaborative, the DAC, which is amazing. If somebody looked that up, they would find out so much information. There's a whole roadmap that it's called the roadmap, and it helps people the journey of dealing and supporting with somebody with dementia. So we now have at least a couple programs being funded in the area agencies to be that resource, to connect more with the community, to make sure they're getting information so when families are coming to the area agency with concerns about dementia. So yeah, there's more happening now, and I think it's a reflection of the aging of the population, and we are seeing more folks being diagnosed.
What do you think people don't know about caregiving that they should know?
It's a very unique experience, I think, for people because every family has different needs, different norms. What I don't think people realize until they find themselves in the caregiving role is what they're really able to do and not do. So I mentioned this T-Care assessment, and I mentioned what's so important, what was kind of groundbreaking about this whole approach was to be able to identify what for the individual was a burden for them. And it's very interesting. You can find somebody who is taking care, like nursing home level care of their, maybe say a spouse, her husband. Anybody else would be in a nursing home, but she is taking care of him at home day and night and fine with it. And somebody finds themselves in a role where their spouse needs more help and they're very uncomfortable with it. And a lot of it has to do with your role identity and what you feel comfortable with. And so I think that what people need to be prepared for is it's okay if there's things you're not comfortable doing, or it doesn't feel right for you. There are resources you can find and people who can support you so that you can still be a caregiver to that loved one, even if it doesn't mean you're doing all the things you know they need help with. And with the whole thing with Alzheimer's, they say is it takes a village. Don't ever try to do it alone. You really, it's somewhere you really need the help of family, friends, community.
What do you think that society or government on the state or local level could be doing to make caregiving a better experience for people?
We need to recognize the importance of that role, and I think that some of that is what we pay people for providing that care. The status of caregiving would change if we recognize the importance of the work and paid people to do that. I know in our state, we do a little better probably than some other states in terms of paying folks for caregiving. There's not enough recognition of how important that work is. I don't think we're a culture where we give that enough attention when it comes to older adults in particular.
Now, here in Washington, we have a new program that's called WACARES.
Yes.
And would you like to say anything about the impact of that?
I give Washington State credit. We often lead the way in trying new things, and it's the recognition that many of us are going to need extra help as we get older. We just are. And again, it's based a lot on what we see in the trends. So the fact that we're going to need that help, and we need a way to pay for that help, and we don't have a good way to pay for that help now, that our state has taken on the mission of helping all of us prepare more for it. I like the idea that it at least gets us thinking ahead. A lot of people don't even know, well, what is long-term care? I don't know what that means. And so first of all, you have to understand that and the kind of needs that folks have. It's not medical care. You know, it's the bathing, it's the getting dressed, it's the eating, cooking meals. There's just the regular activities of daily living that people need help with. And there isn't a good source of funding to pay for that care. So unless you're really low income, and that's what Walk Cares does. It's sort of like everybody gets an opportunity to be saving some money towards the future should they need that kind of care. And I think it's a good program in that it's making us think about that we really, I think if you talk to most people who work in an area agency on aging, one of their biggest concerns is that people aren't thinking ahead. They need to think ahead about these things and plan for it.
So if somebody is kind of convinced now and wants to contact their local area agency on aging, what should they do?
Go to agingwashington.org, because that's kind of easy to remember. All one word, agingwashington.org. And on our website, it's a pretty simple website, but we do have services as a category. What that'll take you to is a map of the state. And you can click on the county you're in, and it will give you the agencies, and it starts with the area agency on aging as the first point of contact. And once you contact them, then you start yourself down the road of like what kind of information you might be looking for, what kind of assistance you might need.
Well, this has been very helpful. I found it very interesting. Is there anything I haven't asked you about that you think is important for people to know?
Caregiving's a lot of work, but it's also very rewarding. And, I think that people, with the right support, it can be a much better experience for them. And the biggest thing for caregivers is you have to take care of yourself. You can't take care of anybody else if you don't take care of yourself. And so that's why it's really important that people find the resources to give them the break they need, the mental health supports they need, the training they need, and never be afraid to reach out and ask for that help, because we all need it. We're all here together to help one another.
Thank you very much, Cathy. Appreciate your time today.
Thanks so much. I've enjoyed it.